Martian Science College, right?
Good evening, everyone. I welcome you all for today's session conducted by Adolescent Health Academy of Telangana. AHA Telangana is a subchapter in Indian Academy of Pediatrics, which is an academic branch of pediatricians all over India. So today's topic is exam results, numbers don't define you. So discuss with the various aspects of this we have with us. I'll just wait for if any office bearers will join. Wait for 1 minute. Let me see if any of our office bearers are joining. So before that, I'm Dr. Anita. I'm a developmental pediatrician and also a health expert based at Hyderabad. I'm the scientific coordinator for all these webinars being conducted under the banner of AHA Telangana. I don't see any of our office bearers joining. Let me introduce Dr. Nandini Bandagantla. She is a senior child and adolescent psychiatrist based at Hyderabad. She did her MBBS from Kasturba Medical College, Mangalore. She went on to UK and completed her MRC site from London and trained from Cambridge and Peterborough NHS Trust. She did her CAMH at Leeds and York Angus Foundation Trust. She has been practicing in Hyderabad for the past 15 years. She is a consultant at Rainbow Children's Hospital at Kondapur, LB Nagar, and Karkhana branches. She is also a consultant at Apollo Jubilee Hills Hospital. She is an EC member at NIPED, National Institute for Empowerment of Physical and Intellectual Disabilities. She is also a research director at Genome Foundation. Madam has her own clinic named as New Leaf at Banjara Hills. This is in collaboration with Indo-British Pain Clinic. Over to you, Dr. Nandini. So to begin with, let us see the scenario. Hope you are ready, Dr. Nandini. You have to unmute yourself, ma'am.
Yes. Can you hear me, Dr. Anita?
Yes, ma'am. Yes, ma'am. Welcome, ma'am. Welcome to the talk show.
Thank you, Anita. Thank you. That's so kind of you. And thank you so much, the Adolescent Health Association, for giving me this opportunity to be a part of this program today.
Yes, ma'am. Yes, ma'am.
Yeah. Can you see me now?
Yes, it's clear. And your voice is also clear. Thank you for accepting our invitation and being a part of this webinar. We need your expertise in dealing with the adolescents in day-to-day life. And this is the time where we had results from in Telangana, SSC results have been released. We have with us Dr. Himabindu Singh, who is our president of Central Adolescent Health Academy. Welcome, ma'am.
Yeah, thank you. And I wish you, can I say a few words, Anita?
Yes, ma'am. Yes.
Yeah. I'm so happy that the Telangana Adolescent Health Academy, under the leadership of Krishnamurthy, Navnihal, and Dr. Anita, are organizing this very useful webinars for the parents. And it is very timely also. As she rightly said just now, the results are out, or maybe just few of the results are coming, and the children need our help. The adolescents need support from us. Some of them who are doing well obviously will be very happy, but those who are little lagging behind should not judge themselves that this is something like a failure or success of life. And this is only one part. They can always cope up, and we should really teach them about resilience, how to bounce back, and how to face this tests in life. So these tests are another, there's always a next time. So I think with this message, I really wish the Telangana Adolescent Health Academy all the best, and would love to see this adolescent care spreading across the country as the national chairperson of Adolescent Health Academy. I really thank all the parents who have logged in. Parents, ఇది మా పీడియాట్రిక్ సంఘంలో ఒక బ్రాంచ్ సబ్ చాప్టర్ ఉంది. అడోలసెంట్ పిల్లల గురించి 10 to 18 years గురించి చాలా ఇంట్రెస్ట్ తీసుకొని వాళ్ళ గురించి వర్క్ చేస్తుంది. అట్లా 4,000 డాక్టర్స్ ఉన్నారు ఆల్ ఓవర్ ఇండియా. మన తెలంగాణలో స్టేట్లో డాక్టర్ అనిత గారు లీడ్ తీసుకుంటున్నారు. సో నేను నేషనల్ లెవెల్లో చైర్పర్సన్గా ఉన్నాను. మీకు ఏ ప్రాబ్లం ఉన్నా మా వెబ్సైట్ చూడండి. అడోలసెంట్ హెల్త్ అకాడమీ వెబ్సైట్లో పేరెంటింగ్ సెక్షన్ కూడా ఉంది. దాంట్లో ఫ్రీక్వెంట్లీ ఆస్క్డ్ క్వశ్చన్స్, అంటే కామన్గా క్వశ్చన్స్ ఉంటాయి పేరెంట్స్కి. అయ్యో మా అమ్మాయి లవ్ అఫేర్ ఉంది, లేకపోతే మా అబ్బాయి చదువుకోవట్లేదు, ఏదో ఒకటి కామన్ క్వశ్చన్స్ ఉంటాయి, వినట్లేదు మన పిల్లలు మాకు వినట్లేదు. దాని అన్నిటికీ కొన్ని ఆన్సర్లు కూడా ఉన్నాయి. ఇన్ ఎనీ హెల్ప్ ది నేషనల్ చాప్టర్ కూడా మీకు హెల్ప్ చేస్తుంది. సో ఐ రిక్వెస్ట్ యూ టు డెవలప్ అ గుడ్ బాండ్ విత్ అవర్ అడోలసెంట్ హెల్త్ అకాడమీ ఆఫ్ తెలంగాణ, who's doing it for community. Congratulations, Anita, and all the best for this session. And I request all the parents to be in the group of which she has created, so that more and more webinars can be held for you. Thank you once again. All the very best for today's session.
Thank you for your kind words, ma'am. సో ఇప్పుడు మనకి ఏప్రిల్లో తెలంగాణలో ఎస్ఎస్సి రిజల్ట్స్ రిలీజ్ అయినాయి, ఇంటర్ రిజల్ట్స్ రిలీజ్ అయినాయి, జేఈ మెయిన్స్ రిజల్ట్స్ కూడా రిలీజ్ అయినాయి. అండ్ వీఆర్ వెయిటింగ్ ఫర్ ద సిబిఎస్ఈ రిజల్ట్స్. జేఈ అడ్వాన్స్ ఇస్ షెడ్యూల్డ్ ఆన్ May 18th అండ్ నీట్ ఎగ్జామ్ ఈరోజు జరుగుతుంది. సో ఆల్ దీస్ రిజల్ట్స్ విల్ బి అవుట్. సో మనం రీసెంట్ గా ఒక న్యూస్ పేపర్ ఆర్టికల్ ఒకటి వచ్చింది ఆన్ 25th April, వేర్ 7 students ఫ్రమ్ తెలంగాణ కమిటెడ్ సూసైడ్ విత్ ఇన్ 2 days ఆఫ్టర్ రిలీజింగ్ ద ఇంటర్ రిజల్ట్స్. ఎందుకు బ్యాడ్ రిజల్ట్స్ వచ్చినాయి, కొంతమంది ఫెయిల్ అయ్యారు, కొంతమంది ఎక్స్పెక్టెడ్ మార్క్స్ రాలేదు, ఇలా మల్టిపుల్ రీజన్స్ తోటి ది కమిటెడ్ సూసైడ్ విత్ ఇన్ 2 days ఆఫ్టర్ ద రిజల్ట్స్ వర్ డిక్లేర్డ్. డాక్టర్ నందిని, how big is this problem? According to you, as a child and adolescent psychiatrist, how big is this problem?
అంటే మీరు చెప్పినట్టు లాస్ట్ April 24th మనకి రిజల్ట్స్ రిలీజ్ అయినాయి, ఇంటర్ బోర్డ్ ఎగ్జామ్స్. అన్ఫార్చునేట్గా రిలీజ్ అయిన ఫ్యూ అవర్స్లోనే, ఐ వుడ్ సే విత్ ఇన్ 48 hours to 72 hours-లోనే వీ హ్యావ్ హర్డ్ దిస్ బ్యాడ్ న్యూస్. 7 people has committed suicide. సో ప్రాబ్లం అనేది చాలా పెద్దగానే ఉంది. బికాజ్ ఏమవుతుంది అంటే కనుక దిస్ ఈజ్ వాట్ వీ కాల్ ఎస్ అన్ ఎండ్ ఆఫ్ ది అకాడమిక్ ఇయర్. ఇది మీరు చెప్పినట్టు April, May, June ఈ టైంలో ఎగ్జామ్స్ ఉండడం వలన ప్రెషర్ ఎక్కువ ఉంటుంది. పేరెంట్స్లో కానీ పిల్లల్లో కానీ ప్రెషర్ ఎక్కువ ఉండడం వలన వీ సీ ఏ సర్జ్ ఆఫ్ కేసెస్ అనేది చాలా ఎక్కువగా ఉంటాయి మాకు. కాస్త మనకి అవేర్నెస్ పెరగడం వలన కూడా బిగినింగ్ ఆఫ్ ది అకాడమిక్ ఇయర్లో కూడా కేసెస్ బాగానే ఎక్కువ ఉంటున్నాయి. ఎందుకంటే చాలా మందికి కాస్త అవేర్నెస్ తెలిసి ఇట్లాంటి ప్రాబ్లమ్స్ ఫేస్ చేయడం వలన టీచర్స్, పేరెంట్స్ కూడా కాస్త తెలుసుకుని మా కిడ్స్లో ఈ ప్రాబ్లం ఉందని అప్రోచ్ అవుతున్నారు, విచ్ ఇస్ ఎ గుడ్ థింగ్. బట్ స్టిల్, ఈవెన్ దో వీఆర్ ట్రయింగ్ అవర్ బెస్ట్, దేర్ ఈస్ లాట్ నీడ్స్ టు బి డన్. బికాజ్ లాస్ట్ టైం ఎప్పుడైతే న్యూస్ విన్నామో ఇట్ వాజ్ రియలీ ఓవర్వెల్మింగ్. ఇట్లా అంటే ఇంటర్ మార్క్స్ అంటే వాళ్ళు రాశారు కూడా, సూసైడ్ నోట్స్ రాశారు కొంతమంది పిల్లలు. బికాజ్ వీఆర్ ఎ ఫెయిల్యూర్, వీ హ్యావ్ ఫెయిల్ ద ఎగ్జామ్, దట్స్ వై వీఆర్ కమిటింగ్ సూసైడ్ అని క్లియర్గా సూసైడ్ నోట్ రాసి చనిపోయిన పిల్లలు కూడా ఉన్నారు. సో అలాంటివి జరగకుండా ఉండాలి అనే దానికి మీరు చేస్తున్న ఈ ప్రోగ్రామ్, ఐ థింక్ ఇట్ ఈస్ రియలీ హెల్ప్ఫుల్ ఫర్ ఆల్ దోస్ పేరెంట్స్ హూ ఇస్ దేర్ అండ్ హూ ఇస్ యాక్టివ్లీ లిజనింగ్ ఇన్ దిస్. Yeah, I think the problem is really big.
సో దీనికి ఏంటి కారణాలు అంటారు? మేజర్ రీజన్స్ ఏమై ఉంటది? ఈజ్ ఇట్ చేంజింగ్ పేరెంటింగ్ స్టైల్ అంటారా, లేకపోతే ఎడ్యుకేషన్ సిస్టమ్ వల్ల అంటారా, లేదా యాజ్ ఇట్ ఈస్ టీనేజర్స్ లోనే ఉండే ఇష్యూస్ లైక్ లైఫ్ స్కిల్స్ సరిగ్గా లేకపోవడం అంటారా, లైక్ కమ్యూనికేషన్ స్కిల్స్ కానీ కోపింగ్ మెకానిజమ్స్ కానీ వీటిలో డెఫిసిట్స్ వస్తున్నాయి అంటారా? వాట్ అకార్డింగ్ టు you are the factors which are contributing to this instant decisions and impulsive behaviors కి?
మీరన్నట్టు దీనికి ఒకటి అని కారణం అని చెప్పడానికి లేదండి. ఫస్ట్ ఆఫ్ ఆల్, సో పేరెంటల్ ఫ్యాక్టర్స్ ఉన్నాయి, ఎడ్యుకేషన్ సిస్టమ్ ఫ్యాక్టర్స్ ఉన్నాయి, తర్వాత పిల్లల్లో ప్రాబ్లమ్స్ ఉన్నాయి, తర్వాత పీర్ ప్రెషర్ ఒకటి. సో ఇట్ ఈస్ ఆల్ మల్టీ ఫ్యాక్టోరియల్. ఒకటి అని చెప్పడం అయితే ఏంటంటే ఇట్ ఈస్ వెరీ ఈజీ, ఇంత ఇంత మనం హార్డ్ వర్క్ చేయక్కర్లేదు. బికాజ్ ఇట్ ఈస్ మల్టీ ఫ్యాక్టోరియల్, అన్నిటినీ ఐడెంటిఫై చేసి చేయడం అనేది ఇట్ ఈస్ బికమింగ్ ఎ హ్యూజ్ ప్రాబ్లమ్. So first nunchi what I feel personally is like these exam results are just one way of measuring the academic performance. But they
Absolutely.
are not completely defining you what you are exactly. ఇప్పుడు
Right.
యాజ్ ఎ పర్సన్, యాజ్ ఎ స్టూడెంట్ నీకు ఎంత క్యాపబిలిటీ ఉంది, ఎంత స్ట్రెంగ్త్ ఉంది, నువ్వు ఫ్యూచర్లో ఏం సక్సెస్ అవుతున్నావు అనేది ఏం చెప్పట్లేదు ఈ ఎగ్జామ్ రిజల్ట్స్. దే ఆర్ జస్ట్ ఓకే ఎకడమిక్స్లో నీకు ఇన్ని మార్క్స్ వచ్చినాయని మాత్రమే చెప్తుంది. అండ్ ఇంకోటి ఏంటి అంటే ఎగ్జామ్ రిజల్ట్స్ వల్ల ఏం జరుగుతోంది అంటే ఇట్ ఈస్ ఎ గేట్ వే టు యూనివర్సిటీ. ఇప్పుడు స్కూల్ నుంచి 12th వెళ్ళడానికి, 12th నుంచి ప్రొఫెషనల్ కాలేజ్కి వెళ్ళడానికి, అక్కడి నుంచి మళ్ళీ యూనివర్సిటీకి వెళ్ళడానికి హెల్ప్ చేస్తుంది తప్పితే ఇట్ ఈస్ నాట్ యాక్చువల్లీ క్వాంటిఫైయింగ్ వాట్ ఈస్ ఎగ్జాక్ట్ హౌ ఫార్ యు ఆర్ గోయింగ్ టు అనేది ఏం చెప్పట్లేదు. బట్ సో నేను అనేది ఏంటి అంటే కనుక ఫస్ట్
one request, someone is requesting converse in English only, they're not able to understand, yes.
Okay. I'll try my best. Okay. So
Really?
what I personally feel is, so the academics exam results are only one measure of academic performance and is not completely defining the whole personality. So you cannot judge a child or a student based on the results. Okay, that is the first thing. Second thing is, these exams are not measuring the other important skills that are necessary to grow up in life or to achieve success in life. For example, a student should have a lot of creativity, emotional intelligence, problem solving. There are so many other factors which are very essential for a student to grow in life. But these parameters are not measured anywhere in academics. So you
Exactly.
cannot say, looking at the exam results, oh, you're a failure or you're a success. It is not a measure at all. It is only a passport to move from one educational institution to another educational institution. So I think we should not penalize every student based on their results. So I think this concept has come into everywhere, into the parent, into the child, into the educational system, into the teachers, and so on. So everybody has to incorporate or indulge in everybody's mind right from the beginning of their academic year that these academics or whatever it is only giving you some knowledge so that you can plan your future, but not how far you can go. Because time again and again has been proving us that academics is not the reason for 100% success. There are so many people who have proved us wrong that, without formal education, without academics, they can go to far beyond success. I mean, to name like the Albert Einstein, he didn't have any academics, but his mom has turned into his teacher. And you know what he has done. If you look at Steve Jobs or Bill Gates, I think there is no one on this earth who doesn't know those two names. And they are the dropped out students, and they have reached so far. If you look at the Indian figures, I think there is no one again on earth who doesn't know Sachin Tendulkar or A.R. Rahman or Dhirubhai Ambani, who have very, very basic education. And everybody in India, I think they treat them as God. So they have proved us, like, if you have, the perseverance, the hard work, how to progress when then there is a failure, how to overcome those hurdles, how to continue your journey. So all these things are very important, okay, to achieve this success in life. So I think all these things have to be incorporated into the educational system. And the science has advanced so much nowadays that when I was going to my school, we have only two options. Like, our parents used to say, either you have to become an engineer or a doctor. We never had any choices. But look at today, there are so many choices. And we were scared to board a flight if we don't have enough degree. But nowadays, kids are traveling abroad. They're finalizing their universities. They're going and settling there with after completing their plus 2. So we have seen so much of change over the few years because of all these advancement and so much of choices. Not only abroad, in India also there are lots and lots of new branches have come. There are very I know high scale jobs, like there is a lot of things like, what do you call nowadays, there is
We have
designing.
designing, we have
Designing. In the designing, you have
graphics,
again graphic designing, interior designing, fashion
fashion
designing,
designing,
robotics. Everybody's, and small kids are also inventing a lot of games, and they're also learning, earning a lot of money right from the beginning.
any on
Not
environmental sciences, marine
environmental
sciences,
sciences is there. Again, business management courses are there.
management courses are
Courses are
there.
there.
Then,
Their event management is there.
yes.
And not to forget the digital marketing. Whatever you're seeing in scrolling in your phones or iPads or whatever it is a digital marketing. So there is a lot of scope. So the only thing is the child has to make up, like, whether he wants to accept the failure and move on or change the career path,
And
because they
one
have
more,
great options.
yeah, wonderfully explained, ma'am. One more thing is, usually the teachers or the parents, when the child is before even the board exams, like when the kid is at sixth or seventh standard, they have to assess what the child's strengths are and what the child's weaknesses are. They have to know what the child is capable of and not capable of. Accordingly, they should have their own expectations, and if they are weak at some point, they have to make them with extra remedial teaching or whatever is required. They should make whatever the required accommodations for the betterment of their academic performance. So that is more important. And just because we don't have a detention policy until ninth, the child is promoted. Even if the child fails in the exam. So in these cases, we are not even able to judge what the child's capabilities are, because nowadays, as you also see, there are lots of cases of learning disabilities also which go undetected. So all these, if you have a little assessment before the board exams, that would be helpful a lot, I guess. Isn't it, ma'am? Do you
Yes, yes,
agree?
definitely. I mean, that's what I said in the beginning of the academics. I think nowadays the awareness is growing much to an
Yes.
extent that the teachers and the parents are able to identify there are
Yes.
certain things like learning difficulties. So they're coming for an IQ assessment, because I think the CBSE board is like, if you identify and inform the board well before the exams, I think they're giving some grace for some subjects. Yeah, so that they can don't develop that pressure inside their head,
Yes.
so that they can peacefully give the exams and they can move on easily. Yes.
No. So, for example, if the child fails or gets very low marks in the exams, so there are different kinds of teenagers. Some are very expressive. They cry out, sit there with the parents and cry out and express their anguish or disappointment. On the other end, we have other kids who are silent sufferers. They don't express anything. So, what is the range of emotions and behaviors which we can expect in such teenagers when the results are declared and which are not up to their expectations?
So as you pointed well, there are what we call as an introvert and an extrovert. So extrovert is able to articulate nicely and tell his problems to his parents. I mean, so many of mothers will say, like, when my son comes back from home or my daughter, she'll talk for an hour so that she has to, vomit everything, whatever has happened. And some other parents will say, like, it is very difficult to open my son's mouth because I don't know what is happening at school. So what we call as an introvert and extrovert. There are two types of people. So when they're articulate, we don't see any problem. But the problem arises when they don't talk and they don't disclose to the parents what exactly are happening. Some students are good, or some kids are good, like, they might express to their close people. If they have a cousin, if they have a good friend, best friend or something, they are able to open up. But for such kids, it is very difficult. And in such situations, the student will also have a lot of emotions, because whenever the exam results are they come out, they have to first of all identify where they have gone wrong. That is first and foremost thing that needs to happen, because based on those things, the child's behavior will be dependent. Okay, let's not go into the what could be the causes for the failure, but coming to your question, there could be a range of emotions. Because they don't talk, there will be a lot of pressure inside a child. So that pressure should not be built up. It has to come out. So whenever the exams are declared, the first 1 week is very crucial, because they are very upset and they're very, very disappointed and they're very sad. So as a parent, as a friend or well-wisher or grandparent, or what they have to do is, first of all, they have to let their child ventilate emotionally. Means, okay, it's okay, it happened. If you want to cry, let it cry. So that emotional ventilation has to be happened in the first week of the, or first couple of days of the, when the results are out. Once that emotional ventilation is gone, the mind will become a little bit clear. Then the child might articulate or might not articulate. If they articulate well, they can express freely with their parents. If they're not able to articulate, you have to try from your end as a parent, or or a well-wisher or a guardian. Even then, if you're struggling to open up the child, then you have to further closely you have to monitor the child, because that pressure is building in him. When the pressure is building, automatically you'll start noticing a lot of behavioral changes, because he's not disclosing to anyone. If you keenly observe the child's behavior will change. Okay, like he might not talk to anyone, the first thing, because he's penting up all the anger inside. He might show that anger on his younger siblings, or he might slam the door, or he might not listen to whatever you're saying. For example, because if he's in such big distress, you go and ask him to come for dinner. Either he'll slam the door on your face, or if you pull him and bring him to the dining table, he might throw his plate off. So these are certain particular behaviors you can make out from the child. And nowadays, the most common other behaviors are, the child is not coming out of the room, because they are so much addicted to these gadgets. They're spending a lot of time inside their room, and the parents will be so anxious, worrying outside and banging the doors. So what the child does inside, you don't know. What is he watching, with whom he is talking? So these are very, very, very crucial things. So what you have to do is, you have to, if the mother knows about an introvert child, she has to inform to all his peers, groups, and everyone. Okay, so that if they're online, so that they can inform their parents that, okay, he's online with me, he's chatting. But if he's chatting with unknown person, we can't do anything. Okay, so otherwise, when he goes to sleep, usually these people, what they do is, they sleep throughout the night. They sleep they stay awake throughout the night, and they sleep in the morning. So it will be furthermore stressful for the mother to understand what exactly is happening. So at least when they're sleeping, I think the mother has to go through the phone and see what exactly is happening, what they're texting, with whom they're chatting. Sometimes when they cannot handle this, they might end up in having depression or anxiety. They might not eat. These are a cycle of events that follows. And some people, if it is a girl, she might end up, cutting herself. If it is a boy, he might not say anything, or he just say that, I'm saying goodbye to everyone. Take care of yourself. He just go to the balcony and then he'll jump from there. So what I'm saying is, introvert personalities, they're very difficult, and the onus is on the parents or the well-wisher to closely monitor them 24/7. So if you have a child who has an introvert personality, and if you're finding it difficult to, then I think you have to install a CC camera to see what exactly is happening in the house. Because it is very difficult to find out what exactly is happening. So you have to be really, really very mindful of what exactly is happening.
Well said, ma'am. You see, whenever the results are coming up, a day or two before, now, it's many times the parents will say, "అరే ఈసారి ఫెయిల్ అయ్యావా చూడు, నా చేతిలో నీకుంట చూడు, నీ పని చెప్తాను చూడు, ఇంక అయిపోయావు చూడు, నువ్వు ఫెయిల్ అయ్యావా, నీకు తక్కువ మార్క్స్ వచ్చావా, నా చేతిలో అయిపోయావు చూడు." These are the few dialogues, common dialogues the parents would say even before the results are released. How do you think the parents should respond before, a few days before the exam results are declared, on the day of the results, if there are bad results, and for a few days later, how to handle their adolescence?
See, I always request all the parents out there. See, it is I mean, I totally understand, because we all are parents at the end of the day, and we all want our kids, to grow well, to be successful in life. But I think at the same time, you have to know your child as well. What are his capabilities? What are his limitations? Based on that, I think you have to pass those remarks, like, whether you can achieve it or whether you cannot achieve it. If you know what are his limitations, I'm sure no parent will talk like that. If a parent doesn't know about a child, if the mother has got only high expectations, I think only that parent will talk like that. But I think I strongly condemn, all parents out there, please do not use such kind of words, because those will really upset the child. Okay, that will demoralize them. They lose their interest in academics. Okay, they might not achieve what they wanted to achieve in life. Rather, please change your wordings, like, rather than, I'll kill you or hit you or beat you, please, rather than using those words, you can say that, is there anything that we can help you this time? If anything goes wrong, what are we doing? You can plan ahead. Okay, so you can always change your dialogue from a threatening to a non-threatening mode. Okay, so I think the communication between a parent and a child always plays a very crucial role. I think parents have to be very mindful of the words what they are using, and they should not be used such words. I mean, I totally understand they're working hard, they want their child to progress, but they should always be aware of their limitations and what a child can achieve and what child cannot achieve. If they have problems in finding out there, then definitely they have to take the expert care, but not demoralize the child's mental health.
Yeah, because that itself creates a fear in the child. Like, what
Yeah,
if I
a disappointment. They might always feel, oh, I'm not able to satisfy my parents. I'm not able to get
am not
the
enough?
grades that are required. Yeah,
Yeah.
that will hinder their performance. They'll start losing their self-confidence, self-esteem, and they
Yes.
might eventually lose their motivation to study.
As you already mentioned, that as we are parents, we always want the best for our child. We want them to get good marks and good ranks. So it's a norm in our state. We have Chaitanya and Narayana, and whenever the results are released, they release a whole page of ad in the newspapers, and all the news channels will be going. ఒకటో ర్యాంకు, రెండవ ర్యాంకు, మూడవ ర్యాంకు, Sri Chaitanya, Narayana. So they have the photos, pictures of the students also displayed. So how is it this thing going to impact on the failure students and their parents? Isn't it going to aggravate their reactions? Because they every parent, you see, even I want my kids photo over there. Everybody, most of the parents would want their kids pictures over there. So if that doesn't come, some parents will take it easy, but there are some parents who will compare this successful students, especially if they are within their family members or in their neighborhood, and compare it with their own kids' performance. Even though they have passed also, they will be comparing the marks. Okay, how, please post your comments on this
I
attitude
mean,
of.
you have asked too many questions, Dr. Anita. I don't know how to answer one after the other. But I'm sure whatever you said, the advertisements that these institutions, put on the newspapers, I think they're really daunting. Yeah, I think they should not give that permission. I think they should not do it. Okay, but I think I personally feel, I might be wrong, I think they are doing it for their um, promotions.
Yes.
It is not, they're not giving any credit to the child. It is for their own promotions, for more, money, more students to go. I think
Enroll.
those things should not happen. That is what I personally feel. Because when I think we have coming to a stage where we are all trying to accept that these exam results are just numbers, not anything beyond that. So when we are trying to at least accept such things, when you're putting this full newspaper of ads, where are we going to? Again, we are going back thinking that, okay, exam results play a major role. So this is a lot of confusion to the parents as well. Okay, mothers who are well educated, they might just say, okay, this is rubbish. But a mediocre, a middle class mother, or a mother who is not educated well, who has a lot of expectations on the child, it will really, really pinch that mother, because she knows how much she has gone through to pay the fees, or to bring the child to that page, and not able to see her son's picture in that newspaper. So it is really very saddening to say that those things are also creating indirectly so much of pressure on the parents as well as the kids. I think that thing should not be happen in the first place.
Yes,
And
not
for
in our
mothers,
yeah, please continue.
and for the mothers who are unable to understand those things, or still want their, I think they need to speak to their friends, relatives, or they need to take some help from the from the expertise, so that they can change their mindset, so that they don't get so much disturbed. Because if a mother in the house gets disturbed, obviously the whole family gets affected, because no child wants to see their mother upset because of them. So they want to try something, whether it's a silly thing or it's a big thing, I don't know.
So these advertisements are obviously not in our hands. So let us see what is in our hands. So what do you recommend the coping mechanism for the adolescents who have these unfavorable results, and how can you guide the parents to what to support their kids? So what all should be done? What would be the coping mechanisms?
So as I mentioned to you earlier, Dr. Anita, the first week is very crucial time, because that is the time where the child is completely shattered. Okay. And he'll be struggling to accept that result. Okay. Is it me? Why did I lose that mark? Or where did I go wrong? So the mother should come, the parents should come, and they should put a hand on his shoulder and allow him to release his emotions. It's okay to feel sad. It's okay to cry. Once you get your emotional ventilation done, then you have to give that confidence to the child that we are there for you. And we are there in this battlefield to support you. These are the two things that happen when immediately the results come on a negative side, or if they fail the exam or whatever it is. So these are the two things that needs to happen immediately in the first week. The first thing is let the child emotionally ventilate. And the second thing is reassurance from the parents is mandatory. When they have done this successfully, I think the child will be in a position to have some clear mind and some clear thoughts, where both the parents and the child can sit together and analyze where things have gone wrong. Was his preparation not sufficient? Or did he put, rather than in that hurry, or in that stress, rather than putting A, or did he put B? Or the concepts which were difficult for him, which he left, did he get those concepts in the exam? Okay. So these are the things that, and many more. And there are so many causes. If I list, I think it will be a big list. If there is any problems in the child, if the child is struggling to understand, if he's got any learning disabilities, or if the child, because of the exams, is he neglecting his health? Is he not sleeping properly? Is he not eating properly? Is there any problems in the families that he's finding it hard to accept it? So these are the lot of things that the parent and the child has to sit down together, and they have to communicate. So the first thing is they have to sit down with them and provide that emotional support. And the second thing is they have to sit down and communicate where exactly things went wrong. And the third thing is they have to, okay, if you again make up your plan, you want to go and repeat your year again, what needs to be done? Okay, you need to have a good atmosphere. You need to have good health. How can you bring your good health? By having some physical activity, so that you can release your stress every day. Keep away from your distractions. If you're watching a lot of, screen time or social media or scrolling, all those things, keep away all those distractions. So you have to come up with a plan that has to be done. And finally, they have to give a lot of importance to the college, where they have to go back to the college, meet their professors or teachers, and find out what is their opinion, like, where he could have gone wrong and where he could correct. So this is a process of events that has to take place. So the first week is emotional ventilation. Second is sit down with the child and communicate where things went wrong. And third is help him how to get better. And last one is, again, does he want to continue in the same career path or he wants to change, and how the parents can support. So these are the chain of events that has to happen so that the child will have a proper coping mechanism as well as the parent. So that mutual understanding is very, very, very important, and parental support plays a crucial role for the child to success.
Wonderfully explained, ma'am. You mean to say the parents have a very huge burden on them and their responsibility on them. So they have to be watchful all the time. So
Yes.
can we just list out all the red flag signs to see? So whatever you have mentioned, I will enumerate. The changes in the behavior, then the changes in the sleep patterns, and the changes in the appetite, and the way they are associating with their friends and all, the way they are behaving with the other siblings and all, their
Yes.
relationships in the family and outside the family,
Mhm.
and anything else, ma'am? So these
Yeah,
what
anger issues, frustration.
anger, frustration.
Yeah. I think, yeah, some girls are like, that would try to, start self-harming.
Hmm.
And yeah, so, and some, I mean, I've been seeing a lot of parents coming nowadays, like, without bringing the child to me, saying that, I'm asking my child to come to you, but she's not coming. But we are worried, so we have come to you for an advice. So this is also what's been happening in the last couple of years. And there are other set of students or the kids where they come to me saying that I've been asking for help to my parents, and my parents think this is not important. So I've just booked an online appointment with you. Please help me. So you see two different types of people in the society. So you have to be very, mindful of all these things. And yeah, whoever is the carer, whether it's a parent or grandparent or whatever it is, they have to be vigilant of all these red
Probably it's
flag
not.
signs. What you have
Probably it's not wise to leave them alone at home also.
exactly,
Is it?
exactly what I'm
And
saying.
again, what the patterns we have observed is many students Google, that Google chat history will also reveal like
Yes.
how to kill myself, how to suicide, self-harm, or I think there are like very like in dark web also many sites which encourage suicide
Yeah,
groups there.
we have not discussed much about this telephone phones. I mean, mobile phones. So I think if a mother is so anxious, if she wants to scold their child regarding their results, I think the mother should have an access to the child's phone. Okay, only then she can scold the child. Okay, otherwise she doesn't have any right, because the child should have access to everything. She cannot just come and say, "Oh, you have done performed very well," without knowing the child. You have to know what child is doing, whether he's studying, whether he's chatting with online people, or whether he's gaming in the night. So you should have I think every mother out there, until the kids are until 18 years of age, everybody should have an access to their phones. I don't know how many mothers have those access, but I think until 18 years, it is wise to have, so that at least we can prevent these suicides.
Thank you, ma'am. And the last question would be, what if such issues arises and how can they seek help if they are in such a remote place where they cannot have direct access to a psychiatrist or a psychologist? What should they do? How can they seek help?
Yeah. As I mentioned before, there are two types of kids, like introverts and extroverts. Extroverts are easy to help, and like introverts are, and like, how we are mentioning about the remote places. I think now the government has come up with a lot of suicide helplines. I think the Telemanas helpline. Recently, I think the AIMS BP Nagar also has started one. Roshni's helpline is there. Astra is another helpline. I think Vandrewala. There are a lot of helplines where a mother has to have. At the same time, I think this information has to be given in the schools as itself, because whichever child is struggling to open up to their parents or to their respective people, I think these people can pick up the phone call and then they can talk to those people and can get the right help. So there are a lot of help outside. Who can express, I think we are all there. who cannot express, I think they can just pick up the helpline and they can seek help.
So there ends my questions. If any of the audience want to ask questions, they can unmute themselves and ask or type in the chat box. To summarize, yes, numbers, marks are just important to gain admission to the next level of education, but it's not the whole and soul thing. We cannot judge the individual capabilities just on the marks gained in one examination. There may be failures, and adolescents and youngsters should be taught resilience, handling their failures also in a positive way, and doing what to do next, and analyzing where they failed and where their deficiencies were, and proceed accordingly. There is always a next attempt, and there is always a second chance. This is not the whole and soul life. Then in the first week, the parents have to be vigilant about the behavior of the adolescents and children, what they are doing, how they are behaving, and have they ventilated out their feelings. And you should provide your unconditional support at that level and keep watchful of what the child is going through. You have to be show your empathy and second their feelings. See, no child wants to fail on their own. They may be facing some difficulties, maybe which went unrecognized. You have to sort out what went wrong. Instead of criticizing the child as if it is his own responsibility, you have to see what went wrong and where it went wrong and seek some remedial action for that. As parents, we have to support them in their crisis. Even if they didn't study and did some gross blunders or mistakes in the exam, yes, we have to be open to forgive them for once and make accommodations to correct their mistakes, because as a human being, everyone commits mistakes and they should be given a chance to correct themselves, isn't it? So anyone, yes, Dr. Karuna, will counseling help to children prior to results together as educator and parents when they know that the student has stress factors or poor performance or health issues? Dr. Nandini?
Yes, definitely. I mean, when you know that the child has issues, it is always better to counsel the child and make them understand. As we said, exam results are just numbers, and understanding them and prioritizing and making plans and for the future is what is needed for the child. So counseling definitely helps.
Any further questions? There are no further questions. We'll close the session. Thank you so much, Dr. Nandini, for being with us today and enlightening on the what to do in the times of crisis for a child, because this is very important. We are seeing so many issues. The kids are going into suicidal tendencies, and that is just at a spur of moment. They think that and do it. So this
Yes.
is what is happening, and they're losing their precious lives. And nowadays, with a single child or two children, this is very hard on parents to accept it. So what all we can do, we'll be doing, we'll be motivating the parents and the children as like to save many precious lives. And thank you, Nandini, for dedicating your life as a psychiatrist for dealing with all these problems of children and adolescents. And a huge applause to you. Also, also educators. Yes. Yes, actually, we need to counsel the educators also, because there is something called soft bullying by teachers, isn't it?
Yeah.
There is, ma'am,
Yeah, they
your,
put a lot of pressure on the child that they have to bring the ranks.
yeah.
So that pressure also, like sometimes make them underperform. That the educators will be like they won't be thinking about that aspect. They'll be continuously putting the pressure on the child. Oh, this is the best child. He's like, very good in his academics. So let's catch him. Let's put pressure, put all the pressure. But what they're missing is how much the child is, how much he can tolerate, that they're not missing. So yeah, it's
Yeah,
not
and
me. Everyone has to understand a child's psychology.
right.
Yeah.
We are done for today. Should know the red flag signs. Yes, Dr. Karuna. Even the educators and parents should know the red flag signs. We have already discussed about that. What are all the red flag signs, which everyone should know. You see, it's not just the parents or the educators. If you see any of your neighboring kid, your friends' kids going through all these things, you can also step in. Maybe as a good aunt, as if you are close to that kid, you can step in as their like buddy who can help the child to ventilate their feelings. If not the parents, someone else can also step in. That is what we call the trusted adult, isn't it, ma'am? You can always go to your trusted adult to vent out your feelings. If your parents are not so open up and accepting for all.
Someone, for that matter, whether it's a trusted one, it need not be a parent. Anyone we can.
Yeah, anyone.
We can trust. Yes.
It could be an aunt, uncle, or a teacher,
Anyone.
your principal. Anyone.
Nowadays, like previously, it used to be only parents, but now it is like that choices have also increased.
Yes.
Yeah.
Yes.
Okay.
Thank you for all the inputs, ma'am. Thank you for enlightening us on that.
Thank you so much, Dr. Anita. Thank you so much for giving me this opportunity once again to Ahat team. Yeah, thank you so much to be a part of you all. Thank you.
Thank you from my side also. Thank you.
Thank you.
And I have put in the chat box ma'am's office number, New Leaf Clinic at Banjara Hills. If someone is.
Thank you, Naganandini. Thank you.
Thank you, ma'am. Thank you so much.
Thank you, ma'am. Himabindu madam, for joining the session. And thank you one and all for joining this session. Have a nice day.
Appreciate you. Thank you.
Thank you.